Hey, what's up YouTube? Welcome back to my channel. This is Dr. David Song, and today I'm going to go over a question and answer period. So if you follow me on Instagram, my tag is Dr. Song, and that's where I actually gathered some questions. I'm going to answer them for you now. Thanks for following me, and let's get this started. So the first question I was asked is from CHCLTY_girl. What is Marfan Syndrome? So Marfan Syndrome is actually an inherited genetic disease that affects the connective tissue of your body. Connective tissue pretty much is almost all of your tissues. It's your bones, your blood vessels, your heart, even in your eyes. Sometimes with Marfan Syndrome you can have blue eyes. It's usually managed medically, combined with other methods of like exercise and stuff like that. Okay, so the next question is from Rajesh Sood 16. Superior gluteal nerve irritation. I guess you just want to know some general information about that. So the nerve is irritated. It could be irritated at the nerve root, causing some buttock pain. It could be irritated more superficially, being compressed by the muscles that surround it. If you want to treat this nerve, you have to find out what's causing irritation of the nerve and then treat that. So if it is a muscular issue that's compressing the nerve, you gotta get the muscle to relax through soft tissue maneuvers and exercise. If it's a nerve root irritation, then you'll have to do some disc herniation exercises like nerve flossing, stuff like that. Okay, so the next question is from It's Me PTR. I suffer from plantar fasciitis. Tried socks and insoles. Is gastrin the only way? No, it's not the only way. Plantar fasciitis is a frustrating condition because it does require some relative rest on your feet because it does impact your foot. The only thing is though, like, how do you do that if your work requires you to be on your feet all the time? So if you are on your feet all the time, any type of insole will work to help give you some support, but you also want to do some of your exercises. You can roll out your plantar fascia on a frozen ice ball to do a self-massage technique there. You also want to do some foot strengthening exercises, do some short foot exercises. You also want to loosen up that calf and calf muscles, so your soleus and gastrocnemius. You can massage those out, you can stretch them out. You also want to strengthen them up by doing some calf raise exercises. And basically that's how you're going to do it. You need to minimize what's aggravating it. You need to increase how strong that the muscles that attach to it are. Okay, so the next question I got is from Chiropractor. Any advice to people suffering from Ehler's Danlos syndrome? That's a tough one. Those who don't know, Ehler's Danlos syndrome is also another genetic condition in which your soft tissue is really loose. So you have a huge amount of flexibility. If you suffer from this kind of condition, you really want to work on any exercises that promote stability. Working on flexibility is not really the thing you want to do. You want to work on strengthening literally like your whole body up. You want to do not necessarily heavy lifting, but just more so controlled movements. If you feel it in your knees, then you gotta do knee strengthening exercises. If you feel it in your elbows, you gotta do arm strengthening exercises. It really depends where you're really feeling it the worst. If it's everywhere, you gotta work out everything. So just work out, exercise, it's gonna go a long way. Weight training is the best way. Plyometrics, not really so much. You wanna do some weightlifting. Next question is from Ruskin Bond Girl. Have an achy back in the lower back left side near the SI joint, the sacroiliac joint. What do I do to alleviate it? That's a really great question. It's more easily said than done. It really depends what's bothering you. Like, you gotta think about it. Why is your SI joint so irritated? If you're finding that the SI joint is irritated when you're standing up, then it could be very much posture related. Are you in excessive anterior pelvic tilt? Is that anterior pelvic tilt happening because you have tight muscles in the quads or hip flexors? Or is it because you don't have really great control of your hamstrings, your glutes, or your core muscles? You have to get it assessed to figure out why you're getting irritation of this joint, and then you address what's causing it. Lots of things can cause irritation of this joint, so you got to figure out why, and then you can determine how you're going to approach working on that muscle. The next question is from Frido Chifit. Very excruciating pain on my knee, especially the right knee, and I have calcaneal on both. Okay, so if you if you have very excruciating pain, especially on the right knee, you gotta figure out why you're getting this pain, okay? Like, I can't be there to diagnose you. You gotta get it assessed. Like, sorry, man, you gotta see. There's lots of things that could cause knee pain. Like, I don't know what your history of injury is. Yeah, I don't know if it's an ACL, MCL, PCL issue, a meniscus tear. I don't know if it's because your movement quality is poor, you have like excessive knock knees whenever you do something like a squat. You gotta figure that out, get assessed, and from there you can determine how to work on that knee, okay? Tons of things could cause knee pain, tons. All right, the next question is about the musculoskeletal manifestation of Lyme disease. So Lyme disease is another systemic disease that's going to be more so managed through medication. You can do general exercise, like things like swimming or light aerobic activity, that'll help to get the blood flowing, and this may help with decreasing local inflammation that you might be experiencing, but that's the most basic approach you can take with it. Whether or not you feel like you have more benefit from weight training or other types of exercises, you gotta see for yourself. It's different from person to person. So the next question is from Pavithra_ND, rotator cuff, how to diagnose it and how to treat it. So that's a really great question. I actually think rotator cuff injuries actually go overly diagnosed from what I see in the field. You always can do your orthopedic test, right? You could do your empty can, your full can, resistant full can, empty can, arm blowers, belly press, bear hug, lift off tests, right, to see which muscles might be affected. And it's like a rotator cuff tendinopathy. If you have 4 of those tests positive and for over 3 months, you have pain for over 3 months and stuff like that. Those are kind of like the protocols, but you want to, if only 2 of them are affected, can you really see it's a rotator cuff tear? Like, honestly, if you have any type of rotator cuff injury, all those tests are going to hurt anyway. So how much value does that give to you if you're a therapist? You have to really question it. Those tests were really made by orthopedic surgeons to see whether or not they need surgery. So you can't really use it the same way that it was originally invented for. A lot of people use it that way, incomplete way of thinking of it. You want to actually look at the person's shoulder, see how it's functioning, see how they move. If they have trouble with shoulder flexion, then figure out why. There's tons of things that can cause it. Is it anterior deltoid? Is it coracobrachialis? Is it one of your pec muscles that's affecting it? Is it because the posterior muscles of the shoulder are really tight lats, right? Tight posterior deltoids. It could be potentially like a dysfunction between your rotator cuff muscles. Honestly, sorry, it's not the best answer to give you. It really depends on what you're seeing in front of you. In terms of how to treat it, find out which muscles are affected, find out which movements are affected, regress that movement down to the most basic level, and then work your way back up to what they want to do. Too many times I see people just giving out external rotation exercises, and it's just like, dude, that's never going to help this person spike again because you're working down here and they need to do this. Gotta make it sport specific, so make sure you do that. The next question is from Mr. Dan Witz, a front rack inner elbow pain. I guess why you're getting it. There's a lot of demands in this position, and if anything along this chain of events I'm going to describe right now is off, you can get elbow pain, like straight up. 1, okay, you need thoracic extension. If you don't have sufficient thoracic extension right through your upper back, you're not going to get your arms up there. 2, you need proper scapular protraction. Your shoulder needs to be able to go forwards along the extended thoracic spine. You need sufficient shoulder flexion. You need to be able to do elbow flexion. You need to be able to get into wrist extension. Now, if any of these are limited, then guess what? You're just going to put a lot of that on the elbow. If you feel it specifically in the inner elbow, you might be loading it up too much in external rotation, and that's putting a lot of excessive strain there. You might be doing this a lot because you can't do this a lot, and so you're just compensating. So you got to figure out what along that chain is not working optimally for you and work on that. The next question is from MG_L. Above the groin, pubic area pain, pelvic, above the psoas. So obviously there's so many things that could be causing pain in that area. It could be appendicitis for all I know, where your appendix is on the right side, and that could be just really inflamed, in which case you need to get that surgically treated. It could be a sports hernia, it could be it could be anything. It could be a tear in your rectus abdominis, it could be it could still be your iliopsoas. I don't know how you get above the iliopsoas. It goes like right into your lumbar spine, so it's not really a horizontal muscle, it's a very vertical, or actually I would say oblique muscle. It goes on an angle. So it really depends where exactly you're experiencing that. Sorry, by description I can't really give you a better answer than that. Right, and the last question we got here is by A_little_smiler. Doctor, what about the pain behind the knee? All right, so pain behind the knee, there's a lot of things that could be going on there. It could be a Baker's cyst. You can have a Baker's cyst forming back there, in which you'll feel a bubble, a bit of a bubble there. In which case that would need to be treated by drainage, so you need to see your medical doctor for that. You could get that surgically removed. It goes away on its own sometimes if you do enough exercise. There's no specific exercise for it, just general exercise will be helpful for that. General leg exercises, I should say. Pain back there, it could be a hamstrings injury, it could be a gastrocnemius injury, it could be a popliteus injury, which is one of the muscles back there that often gets ignored. Honestly, like, it's so hard to tell. Really depends what's going on. Gotta see what's going on. So guys, lesson of the story. I get a lot of these weird general questions. You gotta get it assessed. There's no way I'm going to be able to tell you what it is unless I actually put my hands on you and test things out. So guys, do yourself a favor. Save yourself the time. I know it costs money. Just get it done. Get yourself assessed. Find someone that'll figure it out. And then you can determine what to do from there. All right, peace out. If you have any more questions, please leave some in the comments below. You can always send me a DM over on Instagram as well. I'll do another video segment just like this. Please make your question specific so I can give you a better answer. The more specific the question, the more specific the answer will be. I'll see you guys later next time. Peace out, YouTube.